So what is decompression therapy? So here's what it is. This chair, first of all, is designed with amazing comfort. When you're sitting in it, your legs are in a bent position, so that allows your pelvis to rock back. As it rocks back, it opens up and takes pressure off these discs to allow them to separate. So what is decompression therapy? What happens is the disc that's in between the vertebrae get compressed over time because of misalignment, which is called a subluxation, wear and tear on the body, accident, injury, sitting too much, being overweight, especially belly weight, will start to compress these discs, and they eventually compress a nerve. So this red represents a bulging disc. So a bulging disc will actually start to hit on a nerve, and that causes pain. So the decompression therapy is designed to pull this apart. And what it does, this is the coolest thing, with extreme comfort, it pulls the vertebrae apart just ever so slightly. That allows the disc to start to be reabsorbed back into its space in between the vertebrae. See, if it stays compressed, think of an ice cream sandwich. If you squeeze an ice cream sandwich, the ice cream bulges out. Well, if it were still intact and you could pull it apart, the ice cream would have the ability to go back into the center. Well, that's what we have with our discs. So we have to get movement restored. We do that with different therapies, the adjustment. We do some things at home, but the decompression therapy is something that I can't do with my adjustment. We can't do with basic therapy. It has to be stretched at a very precise amount of tension over a period of time. And what bars is, which is really, really cool, is it pulls for about 10 seconds and then relaxes. Pulls and relaxes. This compression is kind of like an accordion. As you pull apart and relax, the joint space relaxes, so then it can absorb more fluid back into the space. If you're doing straight axial traction where you're just pulling on it, it can start to become too taut and start to pull on muscle fibers and then cause spasm or retraction. Where ours is a gradual change and it allows you to get the results you need in the disc, so you can avoid surgery, chronic pain, chronic sciatic, chronic back pain, and degenerative disc. Over time, if those discs degenerate, you're left with a chronic condition for the last 10, 20, 30 years of your life, which is absolutely miserable. So that's what decompression therapy is. It works amazing if you do it consistently, allowing that disc to slowly and gradually change over time. This is not a one-shot thing, and this is not an overnight success. This is a gradual change to allow healing to occur, but it can happen.